Hey guys, so in the video, just to my side right there, you can see this is a patient coming to therapy for the first time 4 days post-op. You can see that the waterproof dressing has come away from the skin and now it is open to the environment. As long as it stays dry, as long as it doesn't get wet or saturated with any kind of water or blood or seepage, the dressing is fine the way it is. What this individual could do is they could use some tape, surgical tape, to go ahead and tape that end back down, but it is not going to be a waterproof dressing anymore. So this is a situation where some surgeons will provide you with an extra waterproof dressing. You can purchase these on Amazon or in some pharmacies. But my advice to this particular individual was to call the surgical team, whether they talk to the surgeon or the nurse, let them know that the waterproof dressing was coming off, ask them what they would like to do. But at 4 days post-op, there was no sign of drainage, no sign of infection. Everything was healing well. This particular individual was advised to just remove the dressing, keep the area clean and dry for the next 7 to 10 days.